Good morning. Welcome to the Point. It was a busy week in Lansing last week. The governor signed legislation that will create a new tax exemption. It replaces one done away with by that tax bill in Washington. Democrats rolled out their priorities for the coming year, and we'll talk about that in the second half of the show. And the first bill stemming from a work group that went all over the state, listening to concerns about mental health in the state, passed in the House. That's where we begin this morning with Representative Mary Whiteford. Representative, we hear a lot of talk about mental health, particularly in the wake of the tragedy in Florida. But for about a year, there's been a task force here in the state of Michigan, and you as legislators have already started to implement legislation, set rules, come up with guidelines and goals to improve the mental health system here in the state. Can you tell me a little bit about what you've done and what you think you can accomplish?
Sure. So by trade, I'm a registered nurse, and I worked in an emergency room in a city. So I saw so many different things. And then as I became a mom and got more involved in my community, I found out what a huge issue mental health is for our population. Up to 60% of inmates in my county jail were on some kind of psychotropic medication. So with that information, I got on my community mental health board at the county level, and then I represented my county at the regional level, just finding out how funding comes through for this. And I really realized that this is a crisis that we are in as a state. So that was one of my priorities once upon becoming elected, to address some way to figure out how to have better access and better care for the people of our state. I was fortunate enough to reach out to Speaker Leonard, and he formed a task force. So I was a part of that. So from August through December, we traveled around the state, listening to doctors and nurses and families, trying to figure out how we can make it better, because it's such a complicated issue. We have people in jails, we have people who are addicted to drugs, we have people who are developmentally disabled and may have some mental illness as well. It's just so complicated, and it affects every single one of us. So what I decided to put my focus on was access. Over and over again, I hear from people, family members, trying to find help for their loved one, and they cannot get an appointment, they can't get in and get care. We may only have one chance to be a yes person, somebody who says, yes, I can find you the resources you need to help your family member. One chance. If we don't do that, they may never ask again. So that's why one of my major focuses has been, if somebody goes to the emergency room, what happens if they have to be admitted to a psychiatric unit? So I do have a piece of legislation that is being voted on today that addresses that. Right now, if you bring your son to the emergency room, number one, they get an evaluation, and then they'll see a psychiatrist. And then if it's determined that you need to be admitted, the hospital starts making calls all over the state. It can take days. In the meantime, you have family members who are struggling. You have somebody not getting care while they're in a crisis. This goes on. So we're going to use technology. We're going to use the things that we know about what beds are available in the state, and we're going to have a database. So now when somebody goes to the emergency room, the caregivers there just log on, they can see available beds, they can find placement for that person. We are also at a very low number of psychiatric beds in the hospitals in our state. So with this information, we can say, hey, we need beds up in northern Michigan. Let's get it done. So it's looking at it from all different perspectives. Get somebody the help they need. Get the information so we know where to put these beds, so we can get people the help they need before they go out and perhaps have violence. I have found that mental illness is a disease of perception. So the person who is going through it, that's their normal. We have to be there for the family members, the loved ones, the community who see a person, like we hear over and over again, who's in a very serious situation, may do some really bad things. Let's support these people. Let's listen. Let's hook them up. If they need to be admitted to a psych unit, let's get it done. This is how we're going to make things better in our state and in our country.
Talk about beds and access, because that's obviously a problem, and part of that goes, I suspect, with financing.
Yeah. Well, I know in my county, 33% of the residents are on some form of Medicaid, public aid for health care. it is a very low rate of reimbursement. So many hospitals, they have to stay open, right? They have to have enough money to hire employees, to do what they need to do to take care of their patients. If they're not getting funded enough to sustain those beds and to pay the people to take care of them, they're not going to want to open up beds. So that's another issue, is trying to make sure that hospitals are reimbursed enough that they're willing to open up more beds. So that gets more complicated into the financing side, but there are models. If we do have these beds, if we're able to keep them full, that is also a sustainable thing for hospitals, and they'll be willing to open up more beds.
We've got about 60 seconds left, and one of the things I'd like for you to talk about is, in these hearings, one of the things that struck me is that when you started this, when you went to the speaker, and the speaker's been very interested in this was from the get-go a bipartisan effort, and I think sometimes that goes overlooked in Lansing.
Yes. It's always about people. I've always believed in that. If we focus in on the things that are important to our communities, it doesn't matter if we have an R in front of our title or a D, whether we're Republican, Democrat. We need to come up with solutions for the people of Michigan, take away our titles, take away some of our beliefs, and focus in on what's right. We are the caretakers of the taxpayer money in our state. We need to come together and use that money properly, use it correctly, make sure that we're supporting the people of our state, address situations before they get bad, and use our power in that way to work together and have true solutions for the people of Michigan.
Those bills that passed this week are just the first of what may be 70 bills, and those could stretch well into next year. When we come back, what do Democrats have for priorities in this year? We'll talk about it with State Representative David LaGrand. To the point. Welcome back to the Point. Democrats in Lansing this week laid out their priorities for the coming year. They cover any number of subjects, and we talked this morning with Representative David LaGrand. We start with the economy.
Well, I think it's a great moment to take sort of a 20,000-foot view here. There's a lot of conversation about how our economy is in great shape right now, and in certain macroeconomic terms, that's true. We have very low unemployment. Michigan has clearly rebounded after the near collapse of the auto industry almost 10 years ago now, and so. And employers are, talking about a shortage of skilled workers. So we're at a point where we can say, okay, the economy is doing great. In what ways is it not doing as well as it should? And one of those ways, I think, has been real growth of wages for a lot of people in the community. And so it's great that everyone has a job, but if it's a job that, say, doesn't allow you to get affordable housing, that's a problem. And so we really have to talk about whether this is the time to have a conversation about how to make the economy work for everyone, because everyone can clearly participate in this economy right now. The question is whether you win or lose. And then it's also a great point when you have a strong economy to talk about some structural investments in things that are going to let the next generation succeed, because that's what government does. It's about common investment. So, during the Eisenhower administration, they said, we need a national highway system. We're going to spend money. People are going to be able to use this in the future. When the internet happened, we said, we need access to technology, and we want this to spread out nationwide. So we invested in that. We've, as a nation, done research and development funding and governmental funding of R&D work in universities for decades, for basically the entire 20th century through now. And so if you don't do R&D, if you don't develop, if you don't invest, you're not going to be in a good position 10 or 20 years from now. So if you're in a recession and you're worried about whether people can get jobs at all, you should deal with the crisis you're in. We're not in an economic crisis right now, so this is a great time to have a conversation about how to make sure everybody succeeds.
Well, when you talk about everybody participating, and as you accurately point out, statistically, we're at full employment right now. But what do you do if those wages aren't sustainable for, as you say, affordable housing or any number of other things? How do you, from a governmental standpoint, address that? Because that seems like a private sector issue.
Well, the government structures things all the time, right? I mean, we don't have child labor laws. Well, that's a way that the government plays in the labor market. We also have a minimum wage. That's a way that the government plays in the labor market. So talking about, for example, am pretty clear that we need to increase the living wage, the minimum wage in Michigan, because it's not a living wage for a lot of people at the level it's set at. Now, any economist will tell you, if you raise the minimum wage, you do reduce employment fractionally, depending on how much you raise it. I mean, if you raise the minimum wage to $50 an hour, you'd have a whole lot of unemployment. But this is a great time to talk about adjusting it and looking at critical markers for people who are in the economy, like housing. But it's also a great time to talk about our tax structure, because right now in Michigan, if you talk about the total basket of taxes that people pay, people who are less affluent actually pay more as a percentage of their income than people who are more affluent, because some taxes we pay are flat taxes. Sales taxes are a great example. So when you look at the total basket of taxes people pay, we don't have a graduated income tax in Michigan. If we did, we could make our taxes fair. And so that's one of the things that Democrats want to talk about, is a tax structure that really doesn't overburden people who are making less money, which is paradoxical and probably, I don't think, what most people really want.
And just so people understand, the federal tax system is graduated.
It is.
State tax system is a flat for everybody. What would those numbers look like then? Would you lower the bracket? We're at 4.2, 4.1 something?
Yeah.
Would you lower that and then stretch it up on the other side?
Yeah. So actually, we, the Democrats, have a plan. We've run the numbers, and we could reduce taxes for 95% of taxpayers in Michigan, generate an extra $700 and some million in revenue if we stretch taxes, the increase for the top 1%, essentially, the top 5%, to be more precise then. So if 5% of people paid a little more, and then it would only cap out at 10%. So if multimillionaires were paying 10% on their income, 95% of the rest of us would be able to actually have a tax cut, and we'd produce additional revenue.
When you talk about, is that literally multimillionaires, or are we talking about people that are earning $300,000 a year?
I think it's above $1 million is where the top tax bracket is. So where the break happens between, like, would you pay more now or would you pay less now? Yeah, it's in the hundreds of thousands range. So, but that, the average, I think the average household income in Kent County is somewhere in the $50,000 to $60,000 range. I'm a little fuzzy on the math, but the average household in Kent County does not make $200,000 a year, and the people who are making 30 or 40 as a household are, like I said, as a percentage of their income, paying much more of their income for taxes.
One of the tenets laid out in this kind of broad pronouncement of principles talks about small business support. We all know that small business creates the jobs. That's where it comes from.
Well, that's a funny discussion. You're right. All politicians want to say that they're in favor of small businesses. I actually am a small business owner, so for me, that's a little bit of a pet peeve. I think that the advantage of small businesses is that they build community, and they're part of a community in ways that multinational corporations just aren't. I don't know Mr. Exxon. I don't have a great relationship with him. I wouldn't know where to go find him if I wanted to talk to him about how well he was treating his employees. Riley's Hardware is an awesome business, and I know the owners, and I know they're there often when I go in and shop there. So operations like those businesses, when we say small, I tend to think companies that employ between like 5 and a couple hundred employees. Those are really, they're not just the lifeblood of our economy, they're the lifeblood of our community, because they're businesses that statistically reinvest in the community, they have a stake in the community. So we're lucky to have some big people around like Myers and the Amway Corporation who invest back in the community, but so do the folks at Riley's, and so do the folks at Brewery Vivant, and a lot of small businesses are very acutely connected to the community. They know where their market is, and they know who they owe their success to. It's the people in this community, and they want to give back.
So how do you want to support that?
I think one of the things that I personally think is that we have to be careful that our tax incentives don't all go to the big businesses, and I think this is a problem politicians have a lot. Some company rolls into Michigan and employs 1,000 people. There's going to be a great ribbon cutting for that, and everyone can line up and take credit for it. If you have 100 businesses which each employ 10 people, they don't have such exciting ribbon cuttings, right? So I think it's really important we drill down into the local community and find ways to help that happen. Actually, I have a friend, Eric Foster, who's working on microfinancing for smaller minority businesses. That's one of the programs that I'd love to see succeed around here. So I think that people, the more we have operations, and I know that Start Garden is starting to work on that. So I think that this is not just a government thing. This is a community thing. We have to have a collective effort around this. And so there are good operations in the private sector that are working on this, but I think the government has to work on a tax policy that really helps businesses that are not just starting, but that are already here and employ a moderate amount of people, because those are the employers that I get excited about helping.
We can spend the next half hour talking about this, but and I don't want you to cut it short, but briefly explain what you as a caucus mean when you talk about expanding affordable health care, because healthcare has been a conversation that's been going for years and years, but in the last 10 years, it has become a lightning rod.
Sure. I think obviously the Affordable Care Act did great stuff. The Medicare expansion Medicaid expansion was great. I think one of the things we have to focus on right now, where government is really important, is when you have entities that have monopolistic power or quasi-monopolistic power. So like the power company, we want to regulate the power company because I can't get my electricity from anybody else. So we regulate some industries pretty heavily, and one of the industries we haven't done very well on is the pharmaceutical industry. So drug costs, functionally, if I get prescribed a prescription drug that some company has a patent on, I don't have a choice about where to go for that drug, really, and I don't have a choice on how much I'm going to pay for that drug. That's a great place for the government to come in and exercise oversight. And so my Democratic colleagues, I actually co-sponsored a bill yesterday, which was introduced by Representative Camilleri and Representative Garrett, which talked about which initiated discussion and proposed setting up a governmental agency which would oversee, make sure that price gouging doesn't happen, and let the government start playing in the space of controlling drug costs, because we all know how much our healthcare costs. The older you get, the more you notice that the cost of your drugs themselves is a pretty significant component of healthcare.
And that would be done on a statewide basis.
Right.
So what leverage does the state have against prescription drug companies?
Well, first of all, I mean, I think we've all seen recently there have been some examples of just obscene price gouging, when companies take a drug and they just multiply the price by fivefold because they feel like it. Well, our Attorney General can play in that space and bring lawsuits. Another thing we can do, and some states have explored, is negotiating on where the state is a direct player in the healthcare system. We can negotiate perhaps for lower drug costs. The other thing we can do, and some states have done this, I'd love to see some more thought about it, is at some point, seniors go across the border and they buy their drugs in Canada. If that's what we have to do to try to figure out how to make things affordable for people in Michigan, I'm open to it. I want to make sure that healthcare is affordable and accessible, because I think it's a human right, and I think that it's really, look, we have an amazing healthcare system in the United States. We have the best healthcare system in the world, but we have to make sure it's accessible to everybody. Another health issue that I think is really important in Kent County and Grand Rapids is that we wrap our arms around dealing with environmental issues. I mean, everyone saw the PFAS issue out in Rockford, but lead poisoning in Grand Rapids is a big issue. Vapors coming out of old dry cleaning facilities is a big issue. So health is something the government plays in on a lot of levels. So some of this starts to sound like environmental issues, and it is, and they are. Some of it is controlling drug costs, and then some of it is making sure that we really have a community where we deal with mental health better, for example. So we're putting a lot of people in our jails who we probably should be treating, and it's a much more effective and certainly much more moral thing to do if someone has an acute mental health crisis, to try to treat that as a medical issue and not as something that we need to incarcerate people for, because oddly enough, incarcerating people really doesn't work very well as a mental health treatment program.
Interesting to note that a group that you were a part of, listening around the state to mental health issues, has already begun to pass legislation. This past week, a couple of bills were passed dealing with bed capacity and being able to locate that. The first of what I am told could be as many as 70 bills. So in the House, you've already taken a bipartisan swing at the mental health issue.
Yeah, and I really have to give credit to Speaker Leonard for this. This is something that it shouldn't be partisan, right? This is a good policy issue. One of the things that I'm concerned about is that we not have people fall into our jails who can't make bond and then have mental health crises, even in the 2 or 3 days that they're there because they can't make bond. So I've been working on trying to make sure that we're not holding people accidentally on low bonds who really aren't a risk to society. But there are a lot of discussions about training police better for better interventions. In Grand Rapids, we've got I think it's Network 180 is about to build a short-term stay facility so that law enforcement can take people there so they can get stabilized and maybe return home and not get into the criminal justice system. So there's lots of exciting stuff going on. It's a complicated issue. So yeah, 70 bills and Speaker Letter is pretty clear about this. I mean, this is something that's gonna have to happen after he leaves, because he's term limited at the end of this year. So he knows that this is a discussion that he's kicked off that we're gonna have to keep having.
Final point we're going to be able to get to, and there's much more in this plan, and they can find it by going to your webpage, and
Correct.
It's all linked there. But let's talk a little bit about student success. One of the tenets that you and your colleagues talk about is supporting student success. Everybody would support that, but what would your tact be?
Sure. I think there are a couple things that we all intuitively know that we need to really wrap our hands around. One is classroom size. Everybody knows if you've got a classroom with 40 first graders in it, you're not really teaching, you're just doing crowd control. And I think it's time for the state to have some clear standards for maximum class sizes in all districts. And that's one of the things we've been very clear about. Another is a high school degree is not enough to get you a good job in the coming economy. And so we have to stop thinking as though this is the 19th century and when you get through high school, that's a success. It's not enough. We all know that. So we want to start having a conversation about free K-14 education, whether that's helping you get through the first couple of years of a 4-year institution, or whether it's getting you through community college, whether it's skilled trades. The fact of the matter is getting through a 12th grade education is not enough. And so we ought to be in a position where we're thinking about, as a state, making sure that every person in Michigan has the tools to succeed. And so first, making things better, and I think the simplest thing we can have for takeaway there is class size. And then there are other more complicated curriculum things that are always, of course, going to have to be talked about. But really the takeaway is class size and high school is not enough.
Well, and I said that would be the last, but I've got to follow up with this. Both of those things, as a parent with a couple of kids that are still in the school system, having it go through 14 years sounds like a great idea. Having the class size more manageable. I mean, I can't complain because I have a relatively small class size, but 20 kids is a heck of a lot more manageable.
Yep.
However, both of those things cost money.
They do.
So how do you pay for that?
Well, if we had a graduated income tax in Michigan, we'd have some more money. I think at some point we have to talk about what our values are. And yes, if we want things then those things cost money. The education fairy is not going to come along and pay for them. I am very clear. We have to stop as a society talking about taxes as though they're evil. Taxes aren't evil. Taxes are the money that we invest in our future, and we have to have a conversation about whether we're investing that money smart or whether we're not investing that money smart. And I consider every tax dollar that I'm given to handle a sacred trust, which means I am very, very careful. If we're going to spend money, I want you to prove to me that it's a good investment. But there's all kinds of studies out there that show that investment in education is smart, pays huge dividends, and where else would I want to spend money except on your children and my children and helping them succeed? I mean, that's why God put us on this earth, right? To help us take care of those kids. So
LaGrand and his fellow Democrats will continue to talk about those priorities, no doubt, right through the election. We'll be back with more To the Point. So next week, they're back at it in Washington and in Lansing. We'll continue to follow the developments there as we continue to track the upcoming election when you join us every Sunday morning, 10 a.m. for To the Point.